Hello, and welcome to RLC Labs Hypothyroid Hangout on Air with Dr. Amy Myers. My name is Nora, and I'll be helping facilitate the conversation as we go ahead and discuss all things thyroid. First things first, I would like to remind our viewers that this hangout is for informational purposes only and should not be substituted for diagnosing purposes or medical advice. And if you have any questions or concerns, please always discuss them with your doctor. So before we jump in, a quick introduction of our guest today. Dr. Amy Myers is a renowned leader in functional medicine. You've likely seen her amazing blog, her website, her books. She's a two-time New York Times bestselling author of The Autoimmune Solution and The Thyroid Connection. And she's also the founder and medical director of Austin Ultra Health, a functional medicine clinic that treats patients from all over the world who are overcoming chronic illness. She's been featured on The Dr. Oz Show, The New York Post, Women's Health, Huffington Post, and numerous other television programs, radio shows, and print publications. She's helped thousands recover from chronic illness through her dietary-based program, The Myers Way, and she's created multiple programs, tools, and free resources to guide her readers through her revolutionary approach to health. We are so grateful to have her join us today to really kick off Thyroid Awareness Month. And so without further ado, please help me join me in welcoming Dr. Amy Myers.
Hi, thanks for having me.
Thank you so much for joining us today, Dr. Myers.
Absolutely.
So to get started, I was wondering if you can tell us about where your passion for thyroid dysfunction and autoimmune disease really come from, because I read that you have a personal experience with thyroid dysfunction. So would you mind sharing your story with us?
For sure. So yeah, I do what I do every day because conventional medicine failed me, and it's my mission to not have it fail other people. I feel that I can say that being a conventional MD or a conventionally trained one at one point. So my second year of medical school, I started having panic attacks and insomnia and tremors, and eventually my muscles in my legs were so weak I was having to hold the banister to go down the stairs. So I went to the doctor and they brushed me off as just having medical school stress and told me I was just thinking I had everything that I was learning in medical school. And I, of course, knew that that was not true and that absolutely something was going on with me. So I, demanded a full workup, and eventually she called me back and said that I had Graves' disease, which I'm sure many of your listeners know is the autoimmune overactive thyroid. So, and in conventional medicine, all they have to offer you is radioactive iodine, medications to shut down your thyroid from overproducing, and surgery. And none of those really sat well with me. And I, of course, write all about this in the Thyroid Solution. I have two books, The Autoimmune Solution and The Thyroid Connection, and I often combine the two titles by accident because I'm usually speaking too quickly. But anyway, I talk all about this in The Thyroid Connection, and so I'll kind of keep it brief here. But eventually, after searching high and low for any sort of alternative treatments or functional medicine, could not find anything. So I ended up starting with the medication and ended up getting toxic hepatitis. And of course, had to go off that and eventually had my thyroid ablated. So after I was done with my residency in emergency medicine and I was working as an emergency physician, I decided to get back to my roots of trying to find something holistic or alternative, and found the Institute for Functional Medicine and did all my training and eventually opened up my clinic and came up with the protocols that are now the basis of my book, The Autoimmune Solution and The Thyroid Connection.
Wow, that's quite a story, and I'm sorry to hear you had to go through all of that to finally find a solution that worked for you, but that is something that we hear all too often with the patients who visit our page. So since you do have a background or training in conventional medicine, can you tell us a little bit about how conventional medicine and functional medicine differ in their approach to treating thyroid dysfunction?
Sure. So, in general, in conventional medicine, they're really just looking for the diagnosis. And once they have it, it's, pills to placate the symptoms. They're not really looking at the body as a whole. And often with things like thyroid dysfunction and autoimmunity, they don't believe that it can be reversed. And so in functional medicine, the diagnosis is often just the beginning. So it's our starting point. And really the questions we're asking are why? Why did the person get in that boat, and how can we get them out of that boat? So we view the body as interconnected. We view people as individuals, and then usually try to seek the more natural ways to approach things if possible, but certainly rely on prescriptions if needed. So when it comes to Graves' disease, I would say they treat it very dramatically differently. For Graves, I have people go through the program that I have, which is a dietary-based program, using herbs to calm the thyroid rather than harsh medications. And I've had many, many people, both in my clinic and outside of my clinic, just by following the program in the book, who've reversed their Graves completely and not had to do what I had to do. And then, of course, when it comes to Hashimoto's, or any other type of hypothyroidism, when people are caught very early on, sometimes that can be reversed and people won't need supplemental thyroid hormone. But if they do, I would die if I didn't take supplemental thyroid hormone. So, this is not a, plug for you guys, but I legitimately take, Western Thyroid Pure. I actually, it doesn't give me enough T4. So I actually take a little bit of Synthroid as well. So I'm kind of agnostic when it comes to supplemental thyroid hormone. It's what works for the person, but clearly, we do tend to want to go the more natural route, or at least a route that includes some free T3 in it. So, people or physicians, conventional physicians, are typically very resistant to that. So in one sense, again, following the dietary-based program in my books, many people who are early on in the spectrum can, in fact, reverse their Hashimoto's or prevent it from fully coming out if they just have antibodies. If you're somebody like myself who had your thyroid ablated, I don't have a thyroid, I'd die if I didn't take supplemental thyroid hormone. Or people who, took them years to get diagnosed, or they've been diagnosed and had this for 5, 10, 15, 20 years, enough damage has been done to the thyroid, so you'll need some supplemental thyroid hormone. And so in a certain way, that's the quote unquote same treatment as somebody would get through conventional medicine. But in functional medicine, I'm looking at free T3. I care about reverse T3. I'm looking at antibodies. And then, of course, I can speak to myself, far more apt to use supplemental thyroid hormone like Armor, like Western Thyroid Pure, and certainly forms of free T3, because we know all too well of how much better most people can feel when they have some free T3 in their system.
Right. So going a little more in depth about conventional medicine and how thyroid dysfunction is treated there, could you go a little bit deeper, or explain a little more as to what some of the ways in which conventional medicine is just really missing the boat on diagnosing thyroid dysfunction?
Yeah, so I say that there are 5 reasons. One, they're not even testing for it, because the symptoms can be easily brushed away as other diagnoses, particularly women who are, let's just take a woman who just recently gave birth, she's postpartum, her hair is falling out, those last 10 pounds won't go away, and she's exhausted. Well, easily you could say, well, you're a new mom, you have hormone imbalances because they haven't gotten back into balance, you're breastfeeding, the weight just hasn't gone away, easily, written off, and so they don't even check her thyroid. So the first place, or a man, it's less common in men, so men just don't, get their thyroids checked by doctors. Then when doctors are checking it, they're often just checking a TSH, which is really looking at the pituitary. They're not really checking a free T4, reverse T3, free T3, thyroid antibodies. So, so they're not doing the right test. And then even if they do the right test, they're often using outdated reference ranges. So many people know that when they were coming up with the reference range for TSH, it actually, when they were coming up with the reference range for TSH, they actually realized after the fact that they had people with hypothyroidism in that set of patients. And so many people, even the Academy of Endocrinology, believe that this reference range is just way too broad for people. And so there's optimal, and then there's normal, and you may fall into normal but not optimal. And then I write about, they're not looking at nutritional deficiencies. That's a huge reason why I see people not making that conversion from T4 into free T3. And then they're not doing what we do in functional medicine, which is looking at the root cause, for which, I feel like there are 5 main root causes to most chronic illness, and particularly thyroid illness.
I see. So I'd like to get back to the nutritional deficiencies in a little bit, but kind of circling back to when you were talking about the different thyroid hormones and TSH, can you explain to us the significance of all of those and what they really mean?
Sure. So TSH is, well, our hypothalamus releases thyroid releasing hormone that goes down to our pituitary. And then the pituitary releases thyroid stimulating hormone that then goes to the thyroid and says, we need more hormone. That our thyroid then produces T4, which is a storage form, and then it eventually gets converted into free T3, which is the active form, and it goes into our cells and the receptors in every cell in our body. And then when we have enough of that, it's what's called a negative feedback loop. It goes back up to the pituitary and the hypothalamus and says, we have enough, thank you so much. So, so when we're checking a TSH, that's really telling us what the pituitary is signaling to the thyroid. The T4, as I mentioned, the free T4 is looking at the storage form of the thyroid hormone. It's inactive. It just, again, is a storage, which most of our thyroid hormone is sitting as storage. And then when we need it, we get these bursts of free T3 or T3 that can go to free T3, the gas, or reverse T3, the brake. But free T3 is the most active form of the thyroid hormone that does go into all those receptors. So that's why I really consider it the most crucial of all the thyroid labs to test for people. And then you do like to, or I like to look at getting our reverse T3 to free T3 ratio. And I like to know about antibodies on all my patients because, you know, whether you have autoimmune thyroid or not, even though they're not quote unquote treated differently, it really puts you in a different category and says, you know, you need to take this more seriously. You likely have leaky gut. We really need to get down to those underlying factors. You're leaving yourself open to having, you know, another autoimmune disease. So it's in my opinion, you know, very important to distinguish whether you have autoimmune thyroid or not.
I see. So all of that being said, I'm curious to know how the treatment for thyroid dysfunction differs between how conventional medicine approaches it and how you specifically approach it.
Yeah, I mean, I think for the most part, I've kind of addressed that, but, you know, I would say, you know, we can take a look at the program in my book, and that's really how I address it, which is one, looking at the 5 root causes, which is looking at what somebody's eating and changing their diet to get out toxic and inflammatory foods. And I can, of course, go into more detail about any one of these 5, you know, if you want. I look at their gut and see, do they have leaky gut? What imbalances in terms of gut flora and fauna do they have? Do they have infections, candida, small bowel bacterial overgrowth, parasites? I look to see what their stress levels are, how they're practicing stress reduction. Various infections have been implicated, Epstein-Barr, Yersinia, herpes, even small bowel bacterial overgrowth has been implicated with Hashimoto's now. And then I look at toxins, toxic molds. Lyme could either be an infection or a toxin, depending on how you look at it. Heavy metals is a toxin. You know, what are they doing with their beauty and body care products and their home cleaning products and stuff like that. So the first place I really start out of all of those, because I know that can sound a bit overwhelming, is really in changing the diet and fixing the gut. Nearly 80% of our immune system's in our gut, and most all autoimmunity, or most all thyroid dysfunction, is autoimmune in nature. So that really tells me that there's usually something going on in the gut, even if somebody has no digestive symptoms. So changing the diet and fixing the gut are really where I start, no matter what somebody's coming to me for, but particularly with thyroid dysfunction. And then, of course, assessing you know, levels of key nutrients for thyroid function: iodine, selenium, zinc, omega-3 fatty acids, all the things we need, amino acid levels to make our thyroid hormone, convert our thyroid hormone, and then get that thyroid hormone into the cells.
So with all of those, you know, really important vitamins and nutrients that you just listed, where can people get those? What are they, and where, you know, how can people get them into their systems and make sure they're getting adequate amounts?
Yeah, so of course the book, you know, has a whole chapter on nutrients, and then ideally everybody would be getting them through their diet, but our diets are, you know, the soil is depleted, and because of that, our food is depleted in nutrients. And we typically have leaky guts, or we might have low stomach acid, or not having digestive enzymes, or had your gallbladder out, so we might have difficulty digesting and absorbing those nutrients. So, so for that reason, I really do recommend a lot of people take at least a really good quality multivitamin. In fact, I created one to go along with the program in the book. I mean, it's not required, but in working with so many thyroid patients, I was not finding a multi that really had 200 micrograms of selenium, 25 micrograms of zinc. I mean, it really have everything that I think you need to help support that thyroid function. Again, the biggest reason that I really see people have conversion problems from T4 to T3 is not having the nutrients they need to make that conversion. And of course, we always want to get it from our diet, but I just gave you a lot of reasons why diet may not be adequate. And I mean, obviously, depending on what nutrient we're talking about, selenium, you can get it, Brazil nuts, zinc, meats and oysters. So there's B vitamins in your leafy green vegetables, omega-3 fats, and fish. And then, so I talk all about that in the book. And then, of course, I'm sure some of those things that I mentioned, people are like, wait, do you really want to be eating oysters? They're the bottom feeders. So, even when you can get a particular nutrient from a particular food, just because of where we've gone with toxins in our world, it may not necessarily be a food that you want to be eating.
I see. Well, that actually leads me right into my next question for you. You just listed a bunch of great ways, foods and places that people can get these vital nutrients and minerals. So what are some foods that somebody should avoid if they have thyroid dysfunction?
So I think, probably the one on everybody's mind is cruciferous vegetables. I heard that they're goitrogens and they're going to interfere with my thyroid. I mean, most people, when you cook them and you ferment them, it takes out the goitrogenic properties. So it's really in those raw cruciferous vegetables. And most people are not eating enough. They're not drinking kale juice and eating raw broccoli. So in theory, there's always sort of what's in the literature, what's in theory, and then what do I see in practice? And, being a practicing physician, what's in the literature and what you see in real life are often two very different things. But I find most people are not eating enough of that stuff. Although because of that, I do in the program recommend that you don't eat a lot of it raw and that you stick with cooked foods. And of course, the benefits of these cancer fighting properties and antioxidants in these foods far outweighs any risk with them. Then in the more general terms, I look at inflammatory and toxic foods. So inflammatory foods would be things like gluten and dairy, corn and soy, because most of it's genetically modified. I have people in my programs, at least during the 30 days, remove all grains and legumes just because those can feed infections like small bowel bacterial overgrowth and feed candida. They can also have lectins in them that can irritate the gut and cause leaky gut. This, of course, is coming from a woman who was a vegetarian for 27 years. So, eating meat was actually a new thing for me about 5 or 8 years ago. And then inflammatory foods would be things, or toxic foods would be things like sugars and dyes and preservatives and caffeine. So we want to get some of these things out, hopefully indefinitely, and some of these things out just for 30 days and add them back in and see how you respond. But we do know that there's research out there to support, at least with gluten, that a process called molecular mimicry, which is that that the gluten molecule looks very similar to the thyroid molecule. And so when people are eating gluten and they have a sensitivity that's created a leaky gut for them, that large gluten protein that was never meant to get into the body does. Our immune system's right there on the other side of our gut and goes, uh-oh, that's not supposed to be here, and goes to attack it. And as it's attacking it, because the thyroid tissue looks very similar, it can inadvertently attack the thyroid tissue. And that's a process called molecular mimicry or mistaken identity. And that is certainly one of the theories behind autoimmune thyroid dysfunction.
Wow, that's quite a bit of information, but definitely very helpful things that people need to know. So a little more on infections. Can you tell us more about what infections have been linked to thyroid dysfunction?
Yes, absolutely. And before I say that, hopefully that wasn't, I mean, I do want to tell people that I'd like to give, I mean, I do like to give a lot of information, but in my book, I give enough information for you to really understand, like, oh, this is a problem. She knows what she's talking about, but I spend so much time focusing on the solution. So if anybody was kind of overwhelmed by the food component that I told you, it's really, once you get into it, it's really not that overwhelming. And it's, frankly, I mean, how we should be eating, looking at the periphery of the grocery store, eating real whole foods, lean animal proteins, fruits and vegetables. So it's really not that hard. And I'm, hoping that as I'm speaking about things that, people know that the program is actually very easy to follow, and that most of how I spend my time in the book is focusing on the solution and the program rather than, trying to frighten people. But back to infection. So let's see. So Epstein-Barr and herpes have been implicated, I mean, in autoimmunity specifically, and also thyroid dysfunction. Probably the most well-known is Yersinia or Yersina, again, through that process of molecular mimicry, has been implicated in both Hashimoto's and Graves'. There's some new work coming out with small bowel bacterial overgrowth and just hypothyroidism as well as Hashimoto's. There's been some links to hepatitis C. Again, some of these, I talk about this in the book, sometimes it's something called a bystander effect, where the immune system is going to fight, say, the virus or the bacteria, and as it does, it inadvertently damages the tissue around it, which could be the thyroid tissue. There's something called the hijacking effect, where it's mostly with viruses like Epstein-Barr and herpes, where they get into the cell and hijack it. And then there's a process called molecular mimicry that I used when I was talking about the gluten, and that same theory applies to infections and the proteins on the outside of bacteria and viruses. And so that, those are how these infections can cause both autoimmunity and thyroid dysfunction.
I see. So you listed a lot of, things to take in food-wise, to avoid food-wise. What about toxins? So we do live in a very toxic world. What are some of those top toxins that people can avoid, and how? Where do we even look to find them?
So I use a two-step approach to toxins, preventing them from coming in, and then really working, you're not necessarily working, but then getting them out. So prevention is always key. You said, we live in a toxic world, and a lot of times we don't even know that there are toxins around us because they don't, even smell, or we can't see them, but they're there, like mercury in the air. So, if you think about how do we get things into our system? Well, I mean, we eat and drink them in, we breathe them in, and then we absorb them through our skin. So if you just kind of take that, approach, what can you do? Well, I recommend, if at all possible, at home, using natural cleaning products and well, let me just take it back from, ingesting. So, drinking clean water and eating clean food, organic clean food is, a key way that we can prevent them from coming in. Skin, people don't think about it, but, a lot of people have water filters on their tap, but they don't think about having a water filter on their shower. So very important. Very easy to get, very inexpensive. I mean, you can of course get very sophisticated home water filters, but if you can't do that, then getting one just for the shower is great. And so, because when we take showers, the water heats up, some of the toxins in the water vaporize, we then breathe them in, and we absorb them through our skin. So of course, clean water when we're bathing and showering. And then what we put on our skin, our beauty products, and our, makeups, and for men, just even the, shampoos and soaps and all that stuff. And then our air, breathing things in. So clean air, if you can, HEPA filters, if you can, in your house or your office, if you have the ability, the more that you can, prevent things in your own home, we spend so much time there, then, when you go out into the real world, kind of all bets are off. So I try to make my home as safe as I can, knowing that I can't, when I go out in the real world, we all want to live and engage in the real world, and there's only so much that you can do. also back to just kind of trying to buy clean products. You know, if you can, an organic mattress. You're just being cognizant. What's happened these days is that we have, you know, particle board instead of real wood for furniture. We have flame retardants in, you know, our mattresses. We have formaldehydes in our cabinets, and then our houses are so sealed and they're not breathing anymore that the EPA estimates that the indoor air quality can be 5 to 100 times more toxic than the outdoor air quality.
Oh, wow.
So really, you know, protecting your health with or your health with what you purchase in putting in your home, frankly. And then focusing on getting them out. So, you know, making sure you're peeing, pooping, and sweating every day, drinking clean water, peeing a lot, making sure you're having a bowel movement, at least one every day. And then I love infrared sauna for sweating and getting the toxins out.
Definitely. So, you know, sort of in line with toxins, just as we live in a very toxic world, we also live in a very stressful world. So can you tell us a little bit about how stress influences thyroid dysfunction? You know, you went through that yourself in medical school and going through what you did. And then can you also share some of the stress reduction techniques that you had mentioned earlier that you work through with your patients?
Mm-hmm. So yeah, stress can be huge. In fact, I was going through a very stressful event with a toxic mold exposure as I was writing the Thyroid Connection. And so I put a whole chapter about stress and really incorporated stress relieving activities into the daily 28-day plan. So stress, when we have stress, we increase our cortisol. Cortisol has been shown to decrease that conversion from T4 to T3. Cortisol has also been shown to create leaky gut. Cortisol also has been shown to increase our estrogen, and when we have high estrogens, we bind our thyroid hormone. Cortisol creates inflammation when we have cytokines and we're in an inflammatory state. We don't convert from T4 to T3. And then, of course, when we have high stress, we convert more into that reverse or that break of reverse T3 rather than the gas or the free T3. So stress plays an enormous impact. And you know, I like I mentioned, I have a lot of sort of daily stress relieving activities, to things to do every week if you want, to things to try out once a month. So it's really, I try to give a lot of options because, you know, my first book, The Autoimmune Solution, they wanted a very specific plan. And I was like, no, I don't want to do that, because if you're type A like me and likes to do things perfectly and correctly, if that didn't work for you and you get more stressed by trying to do that particular activity because it's not relieving to you, then that's going to like defeat the purpose. So it's important to find what works for you, whether that's meditation for some people, whether that's yoga, whether that's prayer, whether that's, you know, sitting with your dog and petting your dog, sitting with your loved one and watching the sunset. I mean, you have to figure out what are the things that work for you. Certainly slow, deep breaths. It's hard to be stressed when you do that physiologically. And then, you know, I talk about things like heart rate variability, heart math. I mean, if you're a person, I like having apps and things that give me feedback. So there are a lot of things that I mentioned in the book that have apps associated with them, if that's something that you like, to other things that maybe you don't do as often because they require, you know, going out to do them, like floating in a float tank, going to get acupuncture, something like that, going to do neurofeedback. All those things can be, you know, also very helpful to people.
Definitely. Thank you for sharing all of those. Hopefully some of our viewers can try them out and get some stress relief from it. On the subject of autoimmunity, I know that you've said that thyroid dysfunction is autoimmune in nature. What exactly does that mean, and how does somebody even know if they have autoimmunity?
Yeah, so most thyroid dysfunction is autoimmune in nature, and thyroid dysfunction is the #1 autoimmune, you know, condition. So how does somebody know? Through a very simple blood test that their just regular conventional doctor can do. There's several different types. The most common are thyroid peroxidase antibodies, TPO, and thyroglobulin antibodies. And what autoimmunity means is that our body is attacking itself. It's viewing it as foreign and it's beginning to damage it. Say in Hashimoto's, it literally creates inflammation in the thyroid gland, and it begins swelling and in an inflammatory state, and eventually it begins to die. It's a different mechanism with Graves where the antibodies are to the receptors and it's stimulating, causing your body to create more thyroid hormone. So, yeah, but at a fundamental level, it's just that your body's viewing itself or some part of itself, a tissue or organ, as foreign.
Gotcha. So one thing that I do want to ask, and this is something that we see all the time now that you're talking about labs, is so many patients come back and say, my thyroid labs came back normal. They say I'm within range, but they still don't feel any better. So how can somebody have normal labs and find that they still have thyroid dysfunction? Can you explain that to us?
So there are a number of ways. I mean, one is what I mentioned earlier with the TSH, where the reference range many believe is way too broad. So, you know, depending on the lab, you know, my lab goes from like 0.1 up to, I think it's 4.5. So you could have, you know, 4.2 or even a 3 and be told that your labs are normal. But really many people feel that a TSH between 1 and 2 is much more optimal. And those of us that are on something like Western Thyroid Pure that has T3 in it can artificially suppress your thyroid. And so, I mean, your TSH. And so having even a much lower TSH is sometimes optimal for those people. I know that I function better when mine's, you know, lower than 1. The other way that labs can seem normal is that their doctor's just not checking that very crucial free T3. So their free T4 and TSH look normal and they might even look optimal. But when you check out their free T3, it's in the toilet because they're not making that conversion. Or maybe somebody even has an optimal or normal free T3, but you didn't check their reverse T3, and their reverse T3 is way out of balance from their free T3. And then there's even reports of people who have a lot of symptomology just with thyroid antibodies because there's already an inflammatory state going on, but their thyroid labs, again, are either normal or even possibly optimal. So I always believe the patient over the labs. You know, it's really, as a clinician, you need to look at the labs, obviously, but you really need to listen to the patient.
Definitely. And I know that's something that we hear from patients too, is doctors just aren't listening. So thank you for sharing that insight. One question, you know, I think this is on everybody's minds is, can thyroid dysfunction be cured?
So I never use the word cure in anything that I talk about in regarding autoimmunity. I mean, I think it's, you know, it's like cancer. Once you have it, you might be able to go into remission, but it's your weak link, and it's something that you'll probably at least need to be cognizant about, you know, how you're moving through your life. So can autoimmunity be reversed? Absolutely. I see it day in and day out. And when I say reversed, I mean, can people get symptom-free? Can people get off very harsh medications? Can people even get their antibodies to go away? And the answer to all of those is yes. The caveat, so with Graves' disease, I see that very frequently all the time, spared people the fate I had. Hashimoto's, on the other hand, I do like to make the caveat that when you catch it early, like I said, before, you know, damage has occurred, maybe they just have antibodies, maybe they're just in the inflammatory state, or even some damage has occurred, but not a significant amount. Often those people might be able to avoid getting on supplemental thyroid hormone or can get on it and get off of it. But if you're somebody who's, you know, like me, no longer has a thyroid, their thyroid has been damaged. This has gone on for so long. It took them 10 years to get diagnosed. They've been diagnosed for 5 or 10 years. It's like a type 1 diabetic, that if a virus has come in and damaged the pancreas, a vital organ, to the extent that you can no longer make the amount of insulin that you need to properly run your system, well, then you're going to need insulin. And so, you know, that's the same case with Hashimoto's, that if your thyroid, which is a vital organ, has been damaged to the point that you no longer make the amount of supplemental thyroid hormone that you need to optimally run your system, well, you'll need to be on supplemental thyroid hormone. And that's why I call it supplemental thyroid hormone and not medication. You know, there are a lot of people out there in the wellness field, oh, I reversed my Hashimoto's, get off your meds, all this stuff. And some people can do that, and that's great. But for all those people out there that can't do that, I don't want them to think that they're failing. I don't want people to think that they're doing something wrong. This is not a medication. This is a supplemental thyroid hormone that is vital to your living and living optimally. And so by going through a program such as mine, if it's been early on, you very likely may be able to reverse it, not have to go on it, get off of it. If you've been doing this a long time, you might be able to reduce your dose. But you might still need some supplemental thyroid hormone. Again, I would die literally if I didn't take mine. So,
wow. Well, that's all great information. Thank you so much for sharing that insight, Dr. Myers. Before we get into the Q&A, because we got a couple of questions from our viewers, I was wondering if you could just tell us a little bit more about the Myers Way program and, you know, what viewers at home, who I'm sure will go and get your book, and the winners, because we do have a giveaway, what they can expect from your new book, The Thyroid Connection.
So the Thyroid Connection is a 28-day program. It's a dietary-based program. So basically, we're getting out those toxic and inflammatory foods, where the book walks you through, you know, how to figure out, do you have leaky gut? Do you have these infections? How to get rid of them naturally? You know, where to look for toxins in your life, and of course, stress reduction. So, you know, this really came about from first my own experience. You know, I was a vegetarian for 27 years. I now eat essentially a paleo type diet, or what I call the Myers Way. At a fundamental level, it's very similar to, say, an autoimmune paleo protocol. I call it the Myers Way just because I've tweaked it based on what I found in working with thousands of patients in my clinic. Some things, again, that in the research say this, but I never found them to be true, or things that the research didn't say was a problem and I did find to be true, that I kind of tweaked for my program. But at a basis, you know, that's kind of what it is. And I call it the Myers Way because this is, yes, in 28 days, meant to jumpstart your health, get you on the right track, start healing your gut, hopefully reducing medications or supplemental thyroid hormone. But it's really a way of life. It's a way for you. Like I said, this is a journey. You know, once you have autoimmunity, you may be able to add back in some foods, but, you know, there might be periods in life where you need to, you know, ebb and flow with your health, and how strict or how not strict you need to be on the diet. But at a basis, it's a, you know, step-by-step 28-day plan that's filled with dietary guidelines, tons of amazingly delicious recipes, supplementation if you want to do that, you don't need to do that, and of course, the stress reduction part.
Well, that all sounds fantastic, and definitely great ways for people to tune into their bodies and understand what's going on. So to get into the Q&A now really quick, we just had a couple questions that I'm hoping you can answer. So one viewer asked if you could describe the correlation between thyroid issues and triglyceride levels.
Yeah, so it's well known that if you're hypothyroid, your cholesterol can rise. And when I was hyperthyroid, I had very, very low cholesterol. So I'm not 100% sure the mechanism. It's having to do with your liver, and I'm sure just frankly, the processing. I mean, your thyroid regulates your entire metabolism. So if you're hypothyroid, everything's going to slow down, and if you're hyperthyroid, everything's going to speed up in terms of clearing of, you know, of the cholesterol.
Definitely. The next question that we had is, for somebody who's taking medication and, you know, they're feeling slight improvement, how do you know when you go from normal to optimal, and when you're really getting that optimal treatment that you mentioned earlier?
Yeah, I mean, is this from a patient perspective or from a clinician perspective?
From a patient perspective.
Okay. Yeah, I mean, how you feel. I mean, people will tell me that, you know, suddenly they feel like a light bulb came on. The world looks brighter. They've lost a few pounds. I mean, classically, I'm going to be talking about things from a hypothyroid standpoint because that's the more common of the two. But if anybody has hyperthyroid questions specifically, I can address those. So, I mean, I think it's, you know, your hair stops falling out, your skin isn't as dry. And then, of course, you can check labs and see. I mean, that's the one lovely thing about thyroid, is that it's a very inexpensive, readily available lab that you can, you know, provided your doctor is willing to do that. And even if they're not, you know, in the book, I have resources of some labs where you can go order your own labs, because I didn't want people to be at the mercy of their, you know, doctor not being willing to do that. But I mean, frankly, it's just, you know, it's going from feeling okay in your health to feeling amazing in your health.
Definitely. Another question, this is very much in line with something that you had mentioned earlier about a low TSH being better for some people in certain instances. Is that the case for somebody who is normal for their T3 and T4 but has low TSH? Could that be the instance?
I'm a little bit confused about the question. So can somebody who has a normal free T4 and free T3 have a low TSH, and is that okay?
Yes.
Yeah. Yeah. I mean, again, everybody's an individual. We have reference ranges, you know, that you should fit into this category. But, you know, once, if you're a practicing physician, you notice that not everybody fits into these categories. I mean, I've learned that, you know, slightly off topic here, but people will say, I had this reaction to something, and, you know, you read and it's like, that reaction's never been documented anywhere. Well, I always believe the patient. So, yes, if you feel that you are functioning great at that, then that might be your optimal for sure. I mean, there are people when they come in and I'll see, you know, I have optimal ranges listed in the book, and, you know, they're outside of those. I mean, say like a free T3, I like it to be around 3.2, and somebody like today had a patient and their free T3 was 2.8. But they felt amazing. So I don't need to go in and mess. If somebody feels great, I don't need to go in and mess with what they feel like just to make their labs look pretty on a piece of paper. It's all about the patient and how they feel.
Definitely. And the last question is for somebody without a thyroid, are there any specific tests aside from the ones that you mentioned, or specific to the ones that you mentioned, that they should request? And how would treatment be different for them since they don't have a thyroid?
So no, the labs would be exactly the same. And how treatment differs, or like in terms of thyroid, supplemental thyroid hormone, those are people that I definitely want to try to get on something like Thyroid Pure, on a you know, desiccated pig form of supplemental thyroid hormone with T3 in it, because they don't have a thyroid. So people who have a thyroid but it's just a little underactive, I mean, I do have plenty of people who do okay on Synthroid. You know, they make that conversion just fine. They have enough of their own thyroid tissue to kick in and make up for that. Those of us without thyroids, I've found very few of them that do just fine on Synthroid. So those are people that I, unless there's really some contraindication, really want to get on, like I said, like a Thyroid Pure or a desiccated pig gland. I mean, I myself, I've tried just Synthroid, and it's, you know, it's night and day between the two.
Got it. Well, thank you for taking the time out to answer those viewer questions. Before we jump off, I do just want to remind our viewers that we are giving away 3 copies of Dr. Myers' new book, The Thyroid Connection. So for your chance to win, please head over to the Nature Thyroid WP Thyroid Facebook page and go ahead and leave a comment of 1 to 2 sentences describing the most important thing you learned today. We'll select the winners randomly and you'll be notified directly. So with that, Dr. Myers, thank you again for joining us and for sharing all this fantastic information with us. I'm sure our viewers found it very valuable. I know I did.
Thank you so much for having me, and good luck to everybody.
Thank you. All right. Well, everyone, thank you again for joining us, and have a happy, healthy 2017.